As a nursing student and a nurse aide, Aubree Kerr knows the signs of a stroke.
I woke up with a really bad headache, and I was laying there and I couldn't feel like my toes, like they were tingly. And I just was like, I can't go to sleep, because if I go to sleep, there's a high chance I'm not going to wake up.
On May 4th, in the emergency room, Aubree discovered she had been born with a rare group of incorrectly formed blood vessels.
I was born with an AVM, an arteriovenous malformation, and it was made at 8 weeks gestational. It ruptured, and that's what was causing my headache and all the pressure in my brain.
The ruptured AVM caused a stroke, and the 22-year-old woke up with no feeling on her left side. After being placed in a coma at Wesley Medical Center in Wichita, Aubree transferred to the neurology unit at the University of Kansas Medical Center. 2 weeks later, she came to Madonna Rehabilitation Hospitals' specialized stroke program.
She sought intensive rehab right away after her stroke. I think that played all the difference. That is such a huge game changer. That early rehab after stroke is huge. It's a huge piece in the success of a recovery story.
Aubree's physician-led care team implemented high-intensity gait training to improve her mobility.
We started at a pretty big platform walker, then progressed to a regular walker, progressed to a cane. We did a lot of body weight supported treadmill training. It took away any fear of falling. It allowed her to get that intensity of that walking for a longer amount of time to get in more repetition. And I think also implementing our aquatic therapy was huge for her. It was a great way for her to work on her walking without the impact of her own body weight. Every day she came to a therapy session with something new to show me, some new muscle that was firing and working for her, which carried over into her transfers, which carried over into her walking. And every single day she showed a new sign of progress that made it so she was doing more with less assistance.
As she got stronger, occupational therapy sessions in Madonna's nursing skills lab helped Aubree prepare for a return to work. By engaging Aubree in once familiar activities, her care team hoped it would help her body and brain regain function faster by simulating her neural pathways and muscle memory.
I took Aubree down to our skills lab and we worked on rolling and dressing some mannequins. We changed some tracheostomy ties, I had her take my vitals and just things that she would be used to doing. And even when her balance was still fairly impaired, you could just see the familiarity in her movements, and I really saw more of that motor planning component kind of click for her when she was doing those things that she's used to doing every day.
Now, Aubree anticipates that her recovery story will give her a new way to connect with the patients she will care for.
I think I'm gonna be a better nurse to my patients. I can help them talk about it, because I was so young to have a stroke. I had a stroke at 22. And I survived.